The potential positive and negative psychological effects of anabolic steroids. This PowerPoint presentation will look at the following potential positive and negative psychological effects of using anabolic steroids. Anabolic steroids. What are they? Ream and Hersey define anabolic steroids as a synthetic hormone which represents testosterone. Testosterone is a naturally made hormone in male bodies. Anabolic steroids were made to increase absorption and increase the anabolic and androgenic effects of testosterone. Anabolic meaning tissue building and androgenic meaning masculinizing. You see anabolic steroids labeled as AAS. Anabolic steroids are often produced in either oral or injectable formulas. Why are they used? Anabolic steroids are used to increase athletic performance, enhance their physical appearance, and also used to prevent and treat injuries. Who uses them? Users who most commonly take anabolic steroids are amateur, elite, or professional athletes competing in sports such as weightlifting, bodybuilding, football, and track and field. However, recreational users take anabolic steroids to look better. Example, bigger muscles. Dosage. Anabolic steroids are often taken in cycles which can last anywhere from 4 to 18 weeks. After their cycle is finished, they stop using them for a short or long period of time, depending on the athlete. The daily dose on an anabolic steroid cycle can range from 20 to 200 milligrams equivalent of testosterone per day. This is roughly 2 to 200 times the usual therapeutic dose of anabolic steroids. Are there any positive or negative psychological effects from anabolic steroids? The journal article, Confidence by Injection, Male User of Anabolic Steroids speaks of increases in perceived confidence through anabolic steroid use, details how 39 male anabolic steroid users aged 18 to 35 were interviewed about their perceptions of anabolic steroids and if their experience was positive or negative. 37 out of the 39 men claim the experience was very positive, both psychologically and overall. Most talked of having drastically increased self-confidence due to their rapid increase in strength and size. They use the term invincible to describe their self-confidence when on steroids. The participants also talked about how they had the edge while using. The edge being a euphoric mental state where they were more mentally aware and could achieve any goals they wanted. When not on a cycle, they felt they had lost the edge. Some participants stated that they continued cycle after cycle not because of the increase in their strength, but because they wanted to regain the mental edge. When they had finished a cycle, they felt they weren't as mentally focused. Participants told of a significant increase in academic work output and higher grades while using steroids. This links in with the claim of greater mental focus and would make sense when used towards academic performance and output. Participants also had increased feelings of well-being, most likely due to the increase in self-confidence, having the mental edge, and improved results in academic performance, which all led to improved feeling of well-being. The evidence in this article has been further supported by the journal article Life on Steroids. Bodybuilders describe their perceptions of anabolic androgenic steroid use period, where 10 male bodybuilders were interviewed in depth about their anabolic steroid use. All had overwhelming positive reviews. 9 out of the 10 men claimed that their self-confidence was sky high and they had that mental edge that they had never had before. They also reported no negative side effects, which leads to the question, if all of their psychological factors were positive, why do anabolic steroids have such a bad reputation? In answer, there have been negative psychological effects linked with anabolic steroid use. Tommy Chaikin, in a journal article by Greg and Rajetsky, talked about a frightening personal experience with steroids, claiming that steroids can change you in many ways, especially psychologically. Chaikin said he experienced increased anger, mania, anxiety attacks, and severe depression whilst using. Greg and Rajetsky also identified other side effects such as psychological addiction and paranoia from anabolic steroid use. Aggressiveness, also known as roid rage, has been a negative psychological effect linked with the use of anabolic steroids. Ream and Hersey suggest that one might expect to see a user snap or lash out due to anger or frustration in negative circumstances. Several other studies have also shown an increased tendency towards aggressive behavior like irritability, hostility, or violent feelings from anabolic steroid use. Burnett and Kleiman studied 72 male adolescents ranging in age from 16 to 19 years old. 24 were identified as serious weight trainers or bodybuilders on or between anabolic steroid cycles. 24 were serious trainers who did not take anabolic steroids, and 24 were non-athletes. Each completed the Million Adolescent Personality Inventory and the Profile of Mood States. The results showed a significantly higher level of anger and depression in those using steroids compared to those who were currently in between cycles. In saying this, abnormally high levels of testosterone may be disruptive emotionally to the user and could be the cause of negative moods. However, it is also possible for a user in between cycles to experience an increased level of depression due to muscle loss. When off steroids, a person can lose a lot of weight and not be as physically big, which can in turn have psychological effects. Another negative psychological effect is psychological addiction. Greg and Brzezinski discussed the story of a non-competitive weightlifter who met the DSM-3R criteria for substance abuse. DSM means the Diagnostic and Statistical Manual of Mental Disorders. The article explained that the weightlifter was unable to reduce his anabolic steroid use despite being aware that the drug was creating emotional and family dysfunction. There has also been more hard evidence that anabolic steroids are highly addictive. Journal articles by Ulrich and Ewing, Vassallo and Ulrich highlight how easy it is to become psychologically dependent on anabolic steroids, and that anabolic steroid users describe steroid use as being so compelling it's addictive. Like any addiction, whether it be alcohol or smoking, an addiction is never healthy and sometimes hard to break. A psychological addiction to anabolic steroids is therefore a negative effect. Is there enough evidence to prove that steroids have a positive or negative psychological effect? While there is some evidence supporting positive psychological effects of anabolic steroid use, such as increased self-confidence, having the edge, improved academic performances, and feelings of improved well-being, there is also evidence of negative psychological effects such as increased anger, aggressiveness, anxiety and depression, and also psychological addiction. Overall, there is not enough clear evidence to say whether the positive psychological effects of anabolic steroid use outweigh the negative effects. There are mixed opinions, and further study or investigations of the psychological effects is needed to ultimately determine whether anabolic steroid use is good or bad for your mental health. Lastly, there are a lot of other factors involved in determining the effects of anabolic steroid use, such as dosage, environmental effects, and the user's personal goals, to name a few. All of these contribute towards the mindset of the user, and as a result, it is difficult to predict whether an individual will have a positive or negative psychological experience from anabolic steroids. Finally, here are the references that I have used in the PowerPoint presentation. Thank you for watching and listening to my PowerPoint presentation on the potential positive and negative psychological effects of anabolic steroids.